55-year-old grandfather Nicholas was riding to work when he collided with a car which didn't stop.
So this is Nicholas, who was on his motorbike and he's collected with the car.
Dr. Jana is coordinating the trauma room.
No head stroke, no abrasions, no contusions or anything that we can find. Neck, no pain. He's got an open compound fracture on that left side. He's got a cat tourniquet on just below the knee, but he's still bleeding through.
Whenever a tourniquet is put on in the field, that tells you that, the paramedics have been concerned about significant blood loss. You just know straight away that this is a quite significant injury, and he might lose his leg.
You want some help?
I need an ultrasound and somebody to do that.
Treating such a serious leg injury, Senior Emergency Doctor Jonathan Papson brings years of experience to the team.
A motorbike injury is always concerning. You get broken bones and tissue loss. Take layers of skin off and mangle parts of your body. And motorbike injuries are usually awful and nasty.
Oh, God. It's pretty bad. Yeah.
He had a wound that extended almost from the knee down to the ankle with a lot of fatty tissue on view, bone on view. It was contaminated, so that means there was, bits of road in it.
Yeah, it's pretty bad. That leg's pretty bad.
Yeah, we've got to reduce
So
that.
we're going to have to give him something to sedate him,
The foot actually looks dusky. It doesn't look healthy. It looks like the blood supply is compromised. So that's bad. He's at real risk of a really bad outcome with his foot.
Hello, how are you? I'm all right. All right? Yeah. Are you sore? I know you're sore in the leg. Are you sore anywhere else?
All of my leg.
Look, you're going to get an operation for your leg. You've got a fracture there, but all the muscles and stuff are torn open.
Even though the leg looks terrible, occasionally the bleeding is somewhere else, especially with the motorbike injury. We're looking for internal bleeding.
Just doing an ultrasound of your chest.
We're particularly worried because he bled a lot of blood before he got to hospital. The fact that he's had a tourniquet put on means he's had a hell of a lot of bleeding. They've not been able to stop. If you can't stop the bleeding, then the person can die very quickly.
Blood pressure 110 on 80, heart rate 102. That's reassuring. And the scan's looking okay at the moment?
The ultrasound is negative, the chest's okay. Definitely bleeding from the leg. You've got no pulses in the leg.
55-year-old Nicholas's vital signs appear stable, but Dr. Jana isn't convinced.
I'm always suspicious of people that come across with quite a significant injury and have lost a lot of blood, that have a normal blood pressure and have a normal heart rate, because you're thinking, this can't be right.
How many grandkids do you have? 9.
I was having a chat with him about his grandkids. Just having a chat can actually be part of your assessment, because while you're talking to them, you can figure out if they're confused or slurring their speech, and it gives you a lot of information.
That's a lot of Christmas presents.
True that.
We then noticed that he just looked really clammy. I had a feel of his hand and it felt really cold.
He's very sweaty, isn't he?
Yeah.
Yeah, what's going on there? Yeah, why is that?
The hot and cold sweats are warning signs of dangerously low blood pressure.
Do you take any medication for anything?
Blood pressure.
Blood pressure?
Yeah.
The trouble with him is he's on some blood pressure medicine, so he's not giving us the normal signs you get when you bleed. Normally your heart rate goes high and your blood pressure goes low. His heart rate's not changing at all. He's on a blood pressure medicine. It's tricking us. It's fooling us into thinking he's more stable than he is. How you going there? You still with us?
Oh, yeah, sorry,
Yeah.
Is that a real blood pressure?
We checked his blood pressure and it was low. It was really low.
Hi, Nicholas. Can you open your eyes for me? How are you feeling?
Oh, no.
Not good?
Oh,
Tired? Yeah. It's quite cool now, hey? So we've got a BP of 66 on 50. Guys, his blood pressure's in his boots.
When the blood pressure's in your boots, that's really low. And low blood pressure is very dangerous. Anything below 90 is bad. 60, well, it's almost game over.
All right, everybody. Everybody just listen up for a sec.
Early on, we're worried he's got a limb-threatening injury. Now the blood pressure's dropped, things are looking worse. This has turned into a life-threatening injury.
This patient's Now hypovolemic hemorrhagic shock, we're presuming from the leg. I want 2 units of blood via both cannulas. It's bloody hard work because you end up with all your, like my 3, plus the 3 next door, and they're really good kids, but I get a bit nervous when they're all in the pool.
As an emergency physician, I have a pretty weird perspective of the world where all I see is the things that are going to go wrong. So I'm always going to be the mum who's that end of the spectrum of the safety conscious.
Emergency Dr. Maya Cubitt's next patient is arriving by air ambulance on the roof of the hospital.
Hello, Maya here.
On board is a critically injured young woman from country Victoria. 18-year-old trainee jockey Cherie was riding a 600-kilogram racehorse when it reared up and fell back on her while she was still in the saddle.
And when she was found, her leg was pointing in a different direction, which is very suggestive that she's fractured her pelvis.
Emergency physicians in general are really scared of pelvic injuries because they're really unpredictable. Somebody can come in talking to you, looking fine, and the next minute they're dying.
Cherie was practicing track work when the accident happened.
Riding a racehorse and he went up and flipped over on me. Usually I get out of the way of them.
Cherie's mum Natalie works close to the racecourse. When co-workers alerted her, she rushed to her daughter's side to wait for the air ambulance.
Mum's on her way.
Natalie's now driving 300 kilometres to the Royal Melbourne, unaware of how serious Cherie's injuries are.
Inside your pelvis, there's lots of arteries and veins that transmit a large volume of blood. If they are injured in the process of your pelvis being injured, you can bleed to death very, very rapidly. So we need to get a CT scan to make sure that she doesn't have any bleeding in her abdomen, her liver or her spleen or her bladder.
Please breathe in and hold your breath.
Oh, it's a fracture. I'll go and have a look at it.
At the moment, she doesn't seem to have any bleeding in her abdomen. There don't seem to be any other organs that are obviously injured, but we need a bit more time to be sure about what's going on.
She's definitely got that fracture that we could see. So I couldn't see that one on the plain X-ray, and then the one that we saw on the X-rays there.
The fractures could be career-ending for the aspiring jockey.
Hey, so you did fracture your pelvis?
I did fracture it.
Yep. So when the horse has come down, it's just squashed it and it's just popped open a little bit, okay? So there's a couple of bones in there that are broken. We just need to make a plan for what that needs.
Okay.
Okay? Oh, shit house day. So many injuries, even every now and again, one of them matters more.
Yep.
My immediate concern when I am dealing with somebody with a pelvic fracture like this is whether or not Cherie is going to make it out of my department alive.
So we're going to get you some pain relief, and then we're going to pop a different binder on over the top.
At the Royal Melbourne Hospital, trainee jockey Cherie has just learned she's broken her pelvis in a shocking riding accident when her 600-kilogram racehorse reared up and fell on her.
It's going to be a bit sore.
The injury could end the 18-year-old's dream career, but emergency Dr. Maya Cubitt has graver concerns.
These types of injuries are potentially life-threatening. You can die from a fractured pelvis of this nature. So I'm going to hold on to your head while these guys fiddle with all of this stuff.
Cherie's accident happened at a country racetrack 300 kilometres away.
Were you due for some races?
No, not a jockey yet.
Ah, training.
Yeah.
A broken pelvis is devastating for Cherie, whose mum Natalie is driving over 3 hours to be with her daughter.
Emergency departments are really scary places, and if you haven't got somebody there to advocate for you, it can be a pretty lonely place. So it's important that we're all cognizant of how she might be feeling and give her the things that she needs, not only for her injuries, but for her emotional safety.
If you cut across the bottom of her pants, Bruce, you should be able to pull the majority of them off.
To minimise moving Cherie and risking further injury, her jodhpurs have to be cut off.
They're great pants. They look expensive.
They are expensive.
Yeah, I know.
could happen yesterday when I was wearing Kmart jeans.
Yeah, it always happens when you're wearing the really expensive ones.
Yep.
When people give us a smile, it makes us realise that we're gaining trust. She's really frightened, she's in pain, and she needs to be able to feel like the people that own control of what's going on in the room, she can trust.
There you go. Can you grab me some on Dancerton, please? Yep. Thank you.
Do you feel like you actually need to vomit?
Sort of just feel a little bit uneasy.
Yeah.
Cherie takes a sudden turn for the worse.
We roll people when they tell us that they're nauseated because we want the vomit to go onto the floor and not into their lungs.
So I would rather not roll you if we don't have to. I think it's important, in fact, that we don't.
Cherie is not displaying any signs that there is ongoing bleeding in her pelvis. Sometimes that's because there's a clot that has formed over the area. The last thing we want to do is dislodge the clot, which puts her at risk of catastrophic bleeding.
Everybody just listen up for a sec. This patient's now hypervolemic, hemorrhagic shock. We're presuming from the leg. So I want 2 units of blood via both cannulas.
Down the corridor, grandfather of 9 Nicholas is fighting for his life after his leg was badly smashed in a motorcycle crash.
Hemorrhagic shock means that he's probably lost, litres of blood, and that's life-threatening.
Dr. Jana Alexander and Dr. Jonathan Papson know that without an urgent blood transfusion, Nicholas has only minutes to live.
He's still oozing, yeah. We'll just resuscitate and then reassess, yeah.
We're just going to give him some blood.
This has got really serious because the low blood pressure and trauma is actually really worrying. It's gone from something that is fairly easy to manage to something much more serious and dangerous.
Nicholas's blood pressure medication masked the usual warning signs, such as a high heartbeat, before his blood pressure dropped.
Jack, can I get you to assess that leg and see if there's any bleeding we can control?
If we send him straight up to surgery with a low blood pressure, his chances of coming out of surgery get lower and lower. So my job is to try and optimize him as best I can, stabilize his blood pressure, give him some blood, warm him up, try and control the bleeding that I can before we send him upstairs.
I just think we just need to get some direct pressure, maybe.
How's the blood pressure, Dana? Still bad?
Still bad?
Seems a bit wrong, doesn't it?
Yeah.
He's not bleeding from the leg, is he?
It's still oozing. The tourniquet's on and it's on tight.
Nicholas's family are on their way. They don't know the grandfather of 9 is battling to survive.
Squeeze the blood in. We're sort of doing a bit of a juggling act to get him good enough to go to the operating theatre.
We don't want to lose this guy, but that's now on the cards. So that's now a very real possibility. So we have to work hard to make sure that doesn't happen.
Can we give him another bag of blood? Thanks.
All right, we'll just shoot that ECG through to you now. Thanks. Bye. All right, he's going to meet us down here.
At the Royal Melbourne Hospital, emergency doctor Scott Taylor is treating patients who've turned up to ambulatory care.
She's 50.
Ambulatory care is people who are essentially walking wounded. You're looking after people with cut fingers, broken arms, rolled ankles.
Dr. Scott's next patient is retired schoolteacher Deborah, who has a badly injured wrist.
I slipped in the shower.
Uh-huh.
It's got polished concrete on the shower floor.
Okay.
And the dog was in there on the mat and I stepped over the dog and just went straight to her.
Yeah, yikes. Okay. I'll just have a look. So just be real gentle. Where is it sore?
Right. Oh, sorry.
That's okay. I've got the support underneath.
Around here.
Yep. Okay. So gently. Okay. Sorry.
Bones tend to break at their weakest point. In Deborah's case, that might be the area just below the wrist joint.
I'd be surprised if you haven't broken something based on how that looks and how much pain you're in, but we should probably take that ring off too before your wrist gets too swollen and it doesn't come off. Will that slide off, do you think?
It should, I think.
I just don't want to
No,
cause you...
maybe it's not going to come off that easily.
No. All right, I'll show you what we're going to do. Yep. Got a nifty little trick here we can use.
A couple of years ago, I learned a trick from YouTube to get rings off fingers. We use like an elasticized shoelace that are in oxygen masks that we have in the department.
We only need part of what actually comes in the pack.
They need to provide a few of those.
Yeah.
Plastic.
Yeah. I mean, it's very much off-label. It's not how it's designed to be used. Can I get you to hold that end for me? Yeah, with just a little bit of tension on it.
Yep.
Okay. And I'm just going to wrap this slowly around your finger.
Wrapping that string really tight around the finger until it's all the way at the end of the finger and compresses the finger as close as we can down to the bone, making as much space as possible.
I'm going to swap ends with you here. So I want you to hold
This one.
that one. Yeah, again with a little bit of tension.
Yep.
And I'm just going to slowly unravel this one. Okay, just make sure you keep the tension on that finger.
And then by pulling on the free end closest to the hand, the ring should slide off around the finger.
It's over that skin around the knuckle.
Yeah.
It's the hard bit.
Yeah, well done.
That's it.
All right, that one's for you, not for
Thank
cash
you.
converters. All right.
We don't normally get our medical knowledge from YouTube, but fortunately this is something that isn't particularly risky and does work really, really well.
An X-ray will show if tripping over her dog has broken Deborah's wrist.
It's actually a little bit worse than we thought. There's a break through this part of the bone here, and there's a couple of breaks through there as well. And it's pointing back that way. So it's what we call a dinner fork deformity. This is probably going to need an operation, but before we can even get to that, we're going to need to straighten it out. She's done a really good job of it.
So I would rather not roll you if we don't have to. I think it's important, in fact, that we don't.
Over in Trauma Bay 1, Dr Maya Cupid wants to avoid the risk of triggering bleeding in 18-year-old Cherie's broken pelvis.
So I don't want you to vomit on your back. But the less moving around we do, the better.
The trainee jockey was riding a 600-kilogram racehorse when it reared up and fell back on her.
Have a sniff of this. It's a bit of a weird thing, but it helps take away the sense of vomit.
That's a great idea.
So one of our nurses gives Cherie an alcohol swab. There was a study a few years ago that showed that sniffing an alcohol swab is quite a good, what we call antiemetic, or an anti-nausea drug, where we can give it to the patient themselves to hold and they can sniff it, and often it resolves their nausea.
How you doing?
Oh, there.
And look, here come the bone doctors.
Cherie's been waiting anxiously to hear what surgery she'll need. Orthopaedic surgeon John Rayner has some difficult news to break to her.
So you've got a pretty major injury to your pelvis.
Yeah.
Okay, so when the horse has fallen on you, what the images look like is it's giving you a combination injury of squashing it that way and squashing it that way. Okay, and that's why your legs are pointing sort of in this direction. What that requires is an operation to fix the front and the back of the pelvis.
Getting a description about major surgery is really confronting. I suspect patients like Cherie take very little of it in. So the most important thing we can do is to try to give little pieces of information and give them often.
We obviously won't proceed with anything before we have a chat to Mum.
Yeah.
Okay. You're in the right place. We do this a lot. We'll look after you. I know it's pretty scary though, having an operation. But the idea is to try and get you up and walking. Might be a little while though, unfortunately.
It's a major operation and could shatter Cherie's dreams of being a jockey.
A little bit upset.
I think whenever we're delivering news of any significance, we would prefer somebody to have a person there to support them. In Cherie's case, that would obviously be her mum. But I don't think that we would not give her the information while waiting for her mum to arrive, because obviously it's her body and we've got her stuck on a bed and she's in a lot of pain and she needs to know why.
After a heart-wrenching 300-kilometre drive, Cherie's mum Natalie has finally arrived.
We live not even 2 minutes from the airport, so we often see and hear the air ambulance taking off, and every time you sort of hear it, you...
Heart stop.
heart stops a little bit, doesn't it? And you sort of never expect that it'll be your kid going for a little helicopter trip. Yeah, so it was pretty scary when I got the call.
Yeah, very overwhelming. Just nothing's ever happened this bad before.
So the next thing that will happen is they'll try and get some surgery done.
Cherie's operation will determine whether her hope of one day riding a champion will ever come true.
Cherie's particular pelvic injury is actually really rare, and I am astounded that Cherie is not more unwell. And the bones themselves, we can either plate them back together or do an operation with some pins, but the ligaments take a lot longer to heal, and that healing will require significantly decreased activity, and horse riding would definitely be out.
Can I give you a 70-year-old who's had 2 unconscious collapses?
Sure.
There must be a reason why they've rung it through. They're obviously worried about something.
Yeah. I might just go and tell the triage nurses about it, and they can...
And then there's a trauma. You got told about the trauma.
I'll do the trauma with...
Dr. Martin Dutch has been an emergency doctor at the Royal Melbourne for 20 years.
I started at the Melbourne Cricket Ground volunteering with St John, and that really whet my appetite in helping people in trouble and need urgent help.
Hello. Are you all right?
Yep. Oh, I'm always like this.
Just a bit teary and emotional?
Yep.
I'm really passionate about health and emergency medicine, and it's something that I do for my employment, and it's also something that I do in my spare time, volunteering still as a first aider.
What I'd like to do, if it's all right,
Yep.
is I'd like to give you just a tiny amount of medication because I can see that you're stressed.
Yep.
Okay? And it might just help you relax a little bit.
Yep.
Paramedics have arrived with Dr. Martin's 70-year-old patient, Peter, who was found by his wife of 48 years unconscious on the living room floor.
He's collapsed multiple times today, and each time he collapses, he has a low heart rate and low blood pressure. Whenever we hear a story about people who have not only collapsed once, but keep on collapsing, it makes us think that something really serious is going on. Right, so he's got belly pain, he's got back pain, and he's got multiple hypotensive episodes. That made us consider, could he possibly be having a problem with his heart not beating as frequently as what it should, or he was losing blood from somewhere?
Ready, set, go.
The worst case scenario is that Peter's aorta has ruptured. Hello, sir, I'm Martin. I can see you're not feeling very well. The aorta is the main blood vessel that comes out of the heart. It carries about 5 litres of blood a minute. When you've only got 5 to 6 litres of blood, it doesn't take long before you bleed to death. Do you want to take handover from the paramedics? Yep.
At 5 o'clock, Peter's woken up with back pain, and en route he has had 3 episodes of vomiting. He has a history of aneurysms with an abdominal stent in 2011 and an iliac stent in 2019.
Learning Peter's had surgery on his main blood vessel is a vital clue for Dr. Martin.
Because we have this history of problems with his aorta, it now becomes absolutely the most likely thing that's going on with Peter today.
Anything on the scan, Martin?
Yeah, so look, his aorta's not normal. The nursing staff want to get some fentanyl. Using the ultrasound, I could see that there was damage to the wall of the aorta and blood was leaking through the wall. He looks quite clinically anaemic at the moment, just to let you know. He just doesn't look like he's got any circulating volume.
Yeah.
He looks a bit pale.
He looks super pale, I reckon.
How are you feeling at the moment? You feel dizzy?
Yeah.
You feel sick?
We'll try to get into a scanner as quickly as possible.
Yeah. Do you want to book it?
Yes.
And I think we'll start going.
Yeah.
Just ask whether we could be next.
Peter's aorta is bleeding at an alarming rate. Dr. Martin has to decide whether to rush him straight to surgery or burn precious minutes taking him to the CT scanner.
Without the information that we get from the CT scanner, the surgeons would have to do a surgical incision into Peter's belly, which is potentially full of blood, and it would be extremely difficult for them to gain control, and Peter could suddenly bleed to death. This guy's behaving somewhat unwell, just to let you know.
At the Royal Melbourne Hospital, 70-year-old Peter is being rushed for a CT scan to see if he has a potentially fatal burst aorta.
Feet first, abdominal.
Peter's wife of 48 years, Glenda, called paramedics after he kept collapsing at home.
Peter's got a history of problems with the big blood vessel that comes out of his heart. He's previously had to have it repaired. It's a very big blood vessel that carries a lot of blood. If it bursts, then people can bleed to death very quickly.
Dr. Martin Dutch has made the risky call to put Peter in the scanner rather than send him straight to surgery.
Please breathe in and hold your breath.
Sometimes you just need to make a sort of gut call, and I've been doing this for about 20 years, so I decided that the right call is to spend a moment taking Peter to the CT scan so we can better plan what surgical intervention that Peter needs. G'day, can I have a chat with the vascular registrar, please?
If Peter's aorta is ruptured, he'll need immediate surgery to save his life. Dr. Martin does a ring around to put the surgical team on alert.
G'day, Martin Dutch, one of the emergency physicians downstairs. I've got a gentleman, he's got known aortic aneurysm that's previously had an endoluminal repair and has had multiple unconscious collapses and is looking very pale and fairly average. He's on the scanner at the moment, just wondering whether you'd be in a position to pop down. Thanks so much. Cheers, bye.
As Dr. Martin stands by the surgeons, Peter's scan results come in.
Looks like he's ruptured his abdominal aortic aneurysm. And a ruptured aortic aneurysm is about as serious as it gets. Peter is bleeding to death. All right, let's get him off. Let's go back to resus. So, Peter, it does look like there's a problem with the blood vessel.
Right.
The aorta, okay? Now, just out of interest, do you have any family at home? It's the sort of thing that we should probably let them know that this is happening. Were they planning on coming into hospital?
They'll go and ring the hospital.
Right. Well, I will ring them and let them know. Hello, is this Linda? Hi, Linda. My name's Martin. I'm one of the emergency specialists at the Royal Melbourne Hospital. I'm with Peter at the moment. I need to let you know that Peter's reasonably unwell and he's got another problem with that blood vessel, the aorta. Sometimes we need to speak to patients' relatives on the phone. The information that we're transmitting can be really distressing, so I try and be as reassuring as I can be, and at the same time to make sure that it's not lost on them that they need to attend hospital because something really serious is going on. If you pop into the Royal Melbourne, just into the emergency department, and we'll be very, very happy to see you. Don't break any speeding records or anything. We'll take good care of him, okay? No worries, bye.
Okay? All right.
In Resus Bay 6, grandfather of 9 Nicholas is battling to survive after a motorcycle accident left him with a terrible leg injury. He's been given an emergency blood transfusion, but Dr. Jana Alexander and Dr. Jonathan Papson are worried he's still bleeding.
How are you going there, sir?
Oh, my big sore.
Yeah, but you're not sore in your chest or anything like that? No, okay. He's a bit better after a blood transfusion. He's bleeding somewhere, definitely bleeding from the leg, but he's got a tourniquet on, so the blood, we're cutting his blood supply off, so that really hurts. So that's why he's moaning. It's really uncomfortable.
Really well.
Dr. Jana decides to undo the tourniquet on Nicholas's leg.
Can we get a unit of blood up now? They're taking the tourniquet down.
When we released the tourniquet, we then noticed we could stop the bleeding, and then we decided together that the best thing for him would be to go straight to theatre.
He's going to go to theatre. I want to get him up now. So we're just waiting for his wife to come. You all right, Nick?
It's a bit sore.
I know. I know, my love. I know.
Too fat.
You're not too fat.
Yes, I am.
You're just perfect.
My granddaughter told me I'm fat.
Who does?
My granddaughter.
Your granddaughter, how old is she?
2.
In the final preparation for surgery, Nicholas's leg is plastered, then wrapped tightly to keep it stable and protected from infection.
Your wife's coming in. What's her name?
Elizabeth.
Elizabeth? Okay. When she comes, I'll talk to her, okay?
Oh, that's upsetting.
That's upsetting.
Oh, you're a silly woman.
Yeah, we're optimists. We're always hoping that things are going to be not as bad as what we think. But with a big wound like that, you're worried about delayed healing and terrible scars and loss of function to losing your leg.
Yeah, going to theatre.
Knock, knock. Hello. Hello. Did you see the pictures?
Yes.
The bad news is you've made a good mess of that wrist.
At the Royal Melbourne Hospital, Dr. Scott Taylor is treating retired teacher Deborah, who's broken her wrist after tripping over her dog in the shower.
The breaks go into the joint, which is not a good sign because it means that you're almost certainly going to need an operation. But before we can even talk about operation, we're going to need to straighten it out and put it in a better position to take the pressure off the tendons, the nerves, and the blood vessels. Obviously, that's a pretty painful thing.
Okay.
So we've put a really tight blood pressure cuff on your arm and inject some local anaesthetic. Makes the whole arm go numb, and you'll just feel us putting a bit of pressure on your arm, but you won't feel any pain.
Sure, I can do that.
Let me go and start organising that. I'll be back in shortly, okay? All right.
I was hoping it wasn't going to be quite as bad as what he's actually said it is, but it is what it is.
The way Deborah fell, she's broken the bones and impacted them or squashed them on one another. So the way that we fix this and unpack that bone is to pull the injury in the direction that it's already going and making it temporarily worse before pulling it over to its normal position.
Dr. Scott numbs Deborah's wrist with a powerful local anaesthetic.
This is a double tourniquet setup. So there's two bladders in case one of them fails, because we don't want it to go up into the rest of the circulation because that'll be terrible.
These medications can be really toxic and life-threatening if they're allowed to reach the heart and the central organs. So we basically want to keep all of the local anaesthetic in the affected arm.
That all sounds really scary, but this is an incredibly safe procedure. I've done this a couple of hundred times. All right, I've never had anything go wrong, and today's not going to be the day.
We're here to help.
Yeah.
Thank you. That's why I'm here. That's the support.
Emergency nurse Kelsey Hibbert helps keep Deborah calm, while Dr. Scott and Dr. Mina Nessam manipulate her broken wrist.
Does that hurt in the hand when I do that?
No.
No, good. All right, so we're good to go.
All right.
You doing all right?
Breaths, you're doing well.
Just stop us if we're hurting.
Make it worse and then put it back in, plumb through it, you reckon?
That pain?
Sorry. A little. Well, I think it's more
Pressure?
More the crunching is a bit off-putting.
And I think it's the squeezing of the hand as well.
Yeah.
With Deborah's wrist now worse than it was before, Dr. Scott can start the traction to pull it back into position.
You'll feel some pressure, but that's pretty much it, all right?
Yeah.
Don't keep yakking.
Keep talking.
That's fine.
The procedure itself can be quite brutal, but although it looks like it's a medieval method of medicine, it's really safe, and the threat to the hand and to the limb is more if we leave things as they are.
The ultrasound will show if Dr. Scott's pulled Deborah's wrist bones back into place or if he'll have to do it all again.
It was a tiny little bit of pain.
An esmol infusion, get them to make it up and bring it down. Yep. Lovely, thank you.
In Trauma Room 2, a CT scan has confirmed Dr. Martin Dutcher's worst fears. 70-year-old Peter has ruptured his aorta, the main artery from his heart.
He's actively bleeding. He's continuing to bleed right at the moment. There is nothing that I can do to stop that bleeding. All I can do in the interim is reduce the amount that he's bleeding each minute. I'm truly concerned about him at the moment.
Peter's wife Glenda and daughter Alison are on their way after an urgent call from Dr. Martin. They don't know Peter's rapidly deteriorating.
Gotcha.
Yeah.
His blood pressure is 67.
Okay.
Without warning, Peter's condition suddenly worsens.
Can we help?
Nurse Zoe Manning rolls Peter into the recovery position.
I think he's unconscious. You're all right, Peter.
When Peter lost consciousness, we need to see whether he's actually had a cardiac arrest or whether this is going to spontaneously improve again. Is he responsive or unresponsive at the moment?
He definitely lost consciousness.
We needed to hurry things along and get him straight to theatre. Yeah, just put me through now, immediately. Thank you.
You all right, Peter? Still with us, mate? You're doing really well, okay?
Eddie Martin speaking. Okay, I'm coming up now. Bye. I just need to go. All right, we're taking him up to 13.
Can I tell you something? The family are here.
Can't do the family at the moment. I will.
Should I get to speak to them?
Get the wife in here right now. Run her in.
Yep.
Peter's wife and daughter have only a few precious moments with him before he's rushed for the surgery they hope will save his life.
We've only got a couple of seconds before we go to theatre.
Be strong, okay?
When Peter's family arrived, I was acutely aware that Peter might, despite all of our efforts, not survive the surgery. And as such, I wanted to give Peter and Peter's wife the opportunity to talk to each other, just in case this was the last time that happened.
Please be strong, okay?
We had perhaps a few moments for Peter's family to attend, but only a few moments. And I thought that the benefit for Peter and his family that experience would have during a critical time like this, I think is an important gift that we can give.
All right, we're ready to go, Gary.
See you later, Peter. Good luck, mate.
Thank you, everyone.
You doing all right?
You're doing well.
Just stop us if we're hurting.
At the Royal Melbourne Hospital, retired teacher Deborah is having her wrist realigned after breaking it when she tripped over her dog.
Just the traction seems to have reduced it.
Emergency Dr. Scott Taylor is trying one more time to manipulate it back into position.
Having done the procedure many hundreds of times, I felt that we weren't quite in the best position. So we had another try at just trying to move it, even just that little bit more to try and improve the position.
I'll just give it a little bit more of a...
Well, that's good.
I did hear a click though.
Yeah, I felt like that last little bit. Yeah. Yep, beautiful. All right. Okay, we're all done here. We're just going to plaster this up. You okay?
I'm okay. It was a little bit traumatic.
We just had a look at your CT scan. So the position is much better, and the procedure went very well. So
Thank you for that.
that's okay. Unfortunately, it's confirmed what the X-ray shows, that it's smashed into more than a couple of bits. I don't think it's going to avoid an operation. We'll just sit tight and wait and see what the orthopods want to do.
Okay.
Deborah had a fall over her dog. We often see people that have tripped over dogs or dog beds. I mean, I've got a beagle named Lily. We always get tangled up in her. They really are a hazard, but I mean, what's life without pets and animals? I know I wouldn't want to be without my dog.
Oh God. It's pretty bad.
Grandfather of 9 Nicholas was left with a badly crushed leg after a shocking motorcycle crash.
How are you going there, sir?
The driver of the car didn't stop.
Everybody just listen up. This patient's hypovolemic, hemorrhagic shock.
Squeeze the blood in.
After many operations, Nicholas is now recovering with his daughter Tiffany by his side.
He loves all his muggles, his grandkids. He's such a good grandfather to them. great dad as well, great father-in-law.
I try to save my foot, but taking veins and everything from everywhere else on me, and it didn't work out. I think life will be different for me. But, we need to make the best of what we have. That's what I tend to do.
When young trainee jockey Cherie's 600-kilogram horse fell on her, it broke her pelvis.
She's definitely got that fracture that we could see.
She's now recovering from surgery.
It was all, wasn't actually unstable, the pelvis. It was still stable, so it didn't need the screws or plates. And they just manipulated it all back into place manually, and it's all back into place now. Yeah, it was just so good to hear that it wasn't as bad as what they thought. My mum's definitely relieved. Took a lot of weight off her shoulders.
The accident put Cherie's dream to be a jockey on hold, but she's still hopeful.
Yeah, so mum's pretty happy with the outcome now. So she's gone home just to make sure everything's ready to get the rehab underway so I can get home.
He definitely lost consciousness.
Dr. Martin's patient Peter had a potentially fatal ruptured aorta when he was rushed for urgent surgery.
Get the wife in here right now, run her in. We've only got a couple of seconds before we go to theatre.
Be strong, okay?
90% of patients with Peter's condition don't survive.
G'day, Martin Dutch, one of your friendly emergency physicians. I was just wondering, I've got a couple of staff that were a bit invested in the survival of your patient earlier on today. Is he alive? He's completely fine. Excellent. He lives.
My wife, she thought it was the end. But, no, I'm still here. To think that I was in emergency, having a procedure done that could have been fatal. But I don't think about that. I've got to think about being positive, getting up, doing things without straining myself. That's the wife said that.
You only need one of those jobs a shift, really, to put a spring in your step, because it's always a good day when your patient lives an emergency.